Hello, this is Dr. Angela Cortal, and I wanted to focus this video on hormones and joint health. Now, on the surface, a lot of people might not realize that there's a very strong connection between your hormone levels and how your joints feel. In this video, I wanted to concentrate on testosterone, estrogen, and thyroid. And as far as what joint issues I'm talking about, it can really span the gamut. Osteoarthritis is one of the most common ones. That's also called degenerative joint disease. And additionally, there can just be widespread areas of musculoskeletal pain, weakness, and lingering injuries. So for testosterone and estrogen, I'm going to talk about them a little bit as one. I realize they are not the same thing. There's very profound differences there. But for our intents and purposes, just as this overview of the topic, testosterone and estrogen are what we'd call sex hormones, and progesterone is another one, a little bit less relevant for our intents and purposes, but very relevant for other conditions out there, women's health, and a variety of other reasons you'd want to have really good progesterone levels. But for degenerative joint disease and testosterone and estrogen, there's a couple of reasons why those are connected, and primarily testosterone is what we would call an anabolic hormone. And if you've heard the word anabolic, that word just in and of itself often gets a bad rap with steroid use and bodybuilding, those kind of things. Anabolic, just at the very root, what it means is that it builds up. It's building more tissue. So in the case of bodybuilding, that's building more muscle tissue. And for us, estrogen and testosterone both help with building up the tissue that are relevant around the joints. What are we talking about there? Cartilage, ligament, tendon, muscles, all of that is important. And when testosterone or estrogen levels are deficient, you're going to have a deficiency in regeneration of those tissues. All of us, all the time, are just breaking down cells just everywhere on a daily basis, and we have to regenerate those. If you have low testosterone or low estrogen, then you're going to be hindered in that way, and your recovery is going to be slower. You might notice that as an acceleration of arthritis, which has been linked to low testosterone and low estrogen, or it may be just something where there's more aches, pains, just creaky, old, uncomfortable feeling joints. Any and all of that really can be related there. Thyroid, very, very similarly, where low hormone, low thyroid, which is called hypothyroidism, is also linked to low regeneration of these musculoskeletal tissues, primarily, again, cartilage, joints, ligaments, tendons. And any and all of these also have a lot to do with pain levels generally. No matter what your diagnosis is, I would say that if you're feeling like you're experiencing chronic pain, it's widespread, lots of different areas, it's just lingering, not resolving, and you have never had your hormones checked ever, I think that's a pretty smart place to at least make sure that's not a part of what's going on for you. I see it very, very commonly in my practice where I have patients that have suffered from years or even decades of joint pain, just lingering injuries, and no one has, no previous provider has really put two and two together. They've never had a full hormone evaluation because, quote unquote, it's not related. And I just think that's doing a huge disservice to patients. So the moral of this story is get your hormones checked if you have chronic joint pain. Thank you.